On August 13, 2026, a specific Medi-Cal transaction was logged into the state's healthcare system. Claim ID 262252010237. This claim requested state reimbursement for community supports and housing navigation. According to the digital paperwork, a state-contracted provider named Serene Health Group was actively delivering these specialized care coordination services to a disabled patient named Matthew Wyatt. The physical reality on that exact date tells a different story. Matthew and his mother were not receiving care coordination. They were stranded in an Oceanside, California motel, paying over $120 a day out of their own pockets to keep a roof over their heads. The stakes for this specific household are severe. Matthew's 79-year-old mother, Sandra, is a stroke survivor. She navigates daily life with severe mobility impairments and requires immediate housing stability to prevent further physical decline. This documented discrepancy links the conversation beyond simple bureaucratic friction. It frames a specific case where a provider billed the state for navigation services while the patients themselves were displaced and seeking their own shelter. The crisis began when the Wyatt family legally vacated a structurally unsafe apartment. They needed a short-term bridge to secure a permanent, safe living situation. The state of California anticipated exactly this kind of crisis. Through the CalAIM program, the family had a pre-authorized flex fund waiting for them. It contained $429, specifically allocated to cover mandatory screening fees and a holding deposit for a new apartment. This record shows the delay wasn't a lack of inventory. The family proactively sourced 2 units on their own, at Modera, Melrose, and the Terraces. When their navigator failed, Serene Health leadership intervened on August 7th, promising to fix the funding. Instead, the process stopped entirely. A bureaucratic safety net explicitly funded by taxpayers to prevent homelessness became the mechanism of their displacement. The family was forced into a motel simply because their contracted provider refused to release $429 of pre-authorized state money. This formal grievance document reveals what happened following that August 7th promise. Rather than processing the funds, Serene Health leadership initiated a total communication blackout against the family. Matthew sent multiple urgent emails, explicitly flagging their hard August 12th move-out deadline and requesting the release of the flex funds to secure their new apartment. Every message went unanswered. The silence carried a steep financial and physical cost. To protect his mother, a stroke survivor, from sleeping on the street, Matthew was forced to drain the family's emergency savings to cover daily motel rates. The days dragged by in that motel room. But behind the scenes, the provider's administrative apparatus was still in motion. Serene Health withheld the housing deposit, ignored emergency emails, and allowed a disabled senior to be displaced on August 12th. The very next day, on August 13th, they submitted a bill to the government for housing navigation services. The Wyatts responded by documenting every failure. They compiled a meticulous 12-page chronological dossier tracking every ignored email, every missed deadline, and every blocked fund. By August 14th and 15th, they bypassed local grievance channels entirely. They took their evidence straight to the top of the state and federal healthcare oversight system. They targeted heavy-hitting regulatory agencies, officially submitting their dossier to the California Department of Justice, Medi-Cal Fraud Division, and the Federal Health and Human Services Office of Inspector General. Looking at their email log, the family then formally notified Serene Health leadership of these federal filings. The goal was to legally corner the provider and force immediate accountability. By logging every silence and missed deadline, the patients turned the provider's own digital record into a liability. It demonstrates that under the scrutiny of an audit, a documented lack of action can be as incriminating as a false statement. This document captures their final administrative maneuver, an emergency request for an expedited provider transfer, designed to immediately extract the family from a dangerous clinical environment. The request specifically identifies Presidium Health as the target provider, citing their mobile, field-based care model as the exact operational antidote to Serene Health's remote negligence. The entire multi-billion-dollar CalAIM framework is built on a basic assumption of trust, that contracted agencies will act in good faith to coordinate care for the state's vulnerable residents. The Wyatts' response demonstrates the impact of organized patient data. In a system where oversight lags behind the crisis, they showed that a meticulous paper trail can force compliance even after a total communication freeze.